To this story now. The Health Market Inquiry report confirms that South Africans are paying excessive amounts for private health care. Now, the 256-page document was compiled by the Competition Commission after a 5-year study. To talk about the damning findings, we're joined by the Health Minister, Dr. Zweli Mkhize. Minister, thank you very much for making the time to speak to us here. So the private health care needs a regulator to watch over it. Why was there none for the past 25 years? Was this an oversight?
No. Well, I think this is where things go wrong, firstly, because opposition and media out there to always criticize government while putting regulations, there's nothing wrong with the private sector, leave us alone kind of thing.
But who's the custodian, Minister?
No, well, you must also balance up and take responsibility. In the instance here, we're talking about this issue. We welcome the report. The inquiry was important that we needed to get the sense. We've just now been piloting the issue of national health insurance because we're trying to deal with reforms that will correct a lot of these issues. When we went back to this issue of this inquiry, there were lots of challenges about people raising concerns of overcharging, concerns of high price of private health care. And when this matter is raised, people don't quite understand it until you get a proper research that actually displays all the weaknesses in the system. Fortunately, President Cyril Ramaphosa last year pulled all these stakeholders, public and private, and said, look, our system is not healthy. It's not well. On both sides, we need to fix. There are lots of things to be done, to be corrected on the private sector. There are lots of things to be corrected on the public sector. So we are now going to be studying to look at the details of what needs to be done. But the reasons why some of the things were not done is because there were lots of court challenges. When we raised the issue around the pricing, and the Commission had made certain funding way back in 2004, there were problems in getting the private sector to cooperate. And when we tried to take the matter further, then some of the matters were challenged in court. And with all of that, it made it difficult to move on with the issue. The other issue, for example, the Commission has raised is that we're not able to regulate properly the licensing of hospitals. So there are hospitals which are many beds in areas which are oversaturated. But when we raised the issue of certificate of need, and of course the matter was being taken to court, these are the challenges that we have to face in dealing with this issue.
Minister,
it's not just lack of will to regulate, but you end up having lots of obstacles.
Who needs to take responsibility, Minister? This sector is neither competitive nor efficient. I suspect that will change perceptions in as far as efficiency is concerned in the private health sector. But in the main, who must take responsibilities for the excessive amounts that people are paying?
Well, the private sector has to take responsibility. The government has to take responsibility, and all of us, the public as well, because we have to actually work on the basis of everyone collaborating to say what is the best way of protecting the consumers in this case. Now, in this case, there's a lot of legislation that is going to be needed to correct this. And when we go about dealing with that legislation, you will notice that you will come across resistance, and we have to work through that. And until that process is finalized, it's going to be difficult. So the starting point is that we have to deal with the question of what the Commission calls a need to have an assessment of the quality, the value for money. If you get treated by a doctor, do we have a way of being able to assess to see whether the person has been overcharged or not? And that needs something that needs to be looked at.
Okay, can I just jump in there, Minister, because you touch on a point that actually affects the people who use these medical services, and that's the consumer.
Sure.
The report says that consumers are neither informed and they also disempowered. So suggestions again being made, or the responsibility being leveled or placed at your door to say you failed to protect South Africans.
That's not quite the case. You know, the private sector, even now we're discussing the issue of national health insurance. You've been publishing all sorts of negative things against what government is trying to do. It's actually, at the end of the day, we have to accept that government has got a responsibility to regulate on the the way we operate on the health services. The health services are not the same as selling cars, where the richest person can buy the most expensive cars and nobody can say anything about it. Health must be treated as a right and not as a commodity. So we need
It has been commodified, though.
Well, yes, indeed. It has been. It's South Africa where it is most commodified. And when we say in the rest of the world, many countries, the national health insurance system puts a cap so that you can actually have equal access, good quality that can be monitored. And of course, you get ridiculed to say, why are we introducing all these reforms? What I think South Africans need to accept is that, yes, there are problems in the public sector, yes, there are problems in the private sector, but government has to be given the opportunity to put the necessary regulations to keep a balance so that on both sides you get the best services from the private sector and the best service, but we're not going to be allowing people to be charged exorbitant amounts that are without any form of regulation.
Minister, final question to you. The suggestion has been made, and you have spoken at length, blaming us in part, the media, for the negative publicity in as far as NHI is concerned. The question here is NHI the equalizer when it comes to trying to balance out what people are being charged in the private sector? Because some are very clear that it's not going to be the equalizer.
Well, you don't become their spokesperson. Let them say so, because the issue is that the rest of the rest of the world is moving towards a point where you've got equal access for all. The disease pattern determines where the person gets treated, and then you need to put caps as to extent to which all of these amounts that gets contributed can be pulled together for the benefit of all South Africans on a basis of social solidarity, where the richer ones are subsidizing the poorer ones, the healthier ones are subsidizing the ones who are sick, and all of that in the process is one form of reform. Then the other one, we still have to put some regulations around how we manage the private medical health. They've spoken about the competition, that only 90% of the beds are actually dominated by 3 players and there's no space for other players. That the collusion that exists between some of the private practitioners and the hospitals make it difficult to negotiate lower tariffs and lower costs for the patients. These are some of the issues that the regulation of hospitals where the beds are put, they are not put in for the benefit of the poor and the underprivileged and the underserved rural areas, because there's a difficulty in actually putting licenses where they are needed. We go to taken to court and all of this. We need to understand that the whole system needs to be overhauled. Everyone needs to cooperate.
Minister, thank you very much for making the time to come and speak to us here. Dr. Zweli Mkhize is the Minister of Health. Let's check.